Dr. Nyam, and Nopparat Institute of Occupational and Environmental Medicine Institute, Department of Medical Services, Ministry of Public Health, Thailand. Before we start, I'm pleasure to be here to present all of you about the topic, the long COVID and workers. First of all, in my presentation, I'd like to provide COVID-19 prevention. Okay, I won't be long. Okay, I'm waiting for the technical support a little bit. Okay, what I said in my presentation, I'd like to provide the COVID-19 report, recently global and country level. And then I will move on to long COVID definition, cause, consequence, and burden outcome, especially on the workplace. And next, in terms of return to work of the long COVID cases, is discussed, including an example of adjustment of the work duty. Good morning, good afternoon, ladies and gentlemen, and distinguished guests. I will start with my first slide. I'm Dr. Kitipong Banomyong from Nopparat Institute of Occupational and Environmental Medicine, Banomyong. That's what I mentioned before. According to the Worldometer's website, recently on December 7th, what we found, nearly 270 million people who suffer from the COVID-19 infection. 5 million days. However, nearly 90% recover in 240 million people recover. Likewise, in terms of country level, like Thailand, on the same date on December the 7th, around 2 million people who infected with COVID-19, dead around 21,000 people dead, and nearly 95% recover, probably around 2 million people. According to the WHO World Health Organization, what we realize, what we know about the long-term effect of the COVID-19, the COVID-19, because of the new emerging disease, therefore, there is an interim document will be updated as the new information arrives. And what does it mean? It means that if we got the new updated information today and tomorrow will be changed. Based on the WHO information on this slide, most patients of COVID-19 mild symptom and moderate illness. Around 10 to 15% got the severe, and 5% get into critical illness. Typically, majority recover around 2 to 6 weeks after infection. Unfortunately, some patients suffer from the medical complication later that may have the last health effect. Moreover, prolonged illness can be found even in young adults and children without underlying disease. Many cases do not regain or catch up the health status before. We know very little about it, especially about the minor illness. But from the statistics data, we can find out some risk factors such as the obesity, high blood pressure, and mental health problems. Because there's no internationally agreed definition of the long COVID. So we have many definitions. I would like to present for some instance. First, from the CDC USA, what is the long COVID? You can focus on the green highlight here about their definition. The CDC defined a wide range of health problems, 4 or more weeks after infection. And CDC found different types of health condition combination and different length of time. From the NIH UK, National Health Services UK, described long COVID has been more commonly described signs and symptoms, but they classify both in ongoing symptoms from 4 to 12 weeks and more than 12 weeks or more. And next, for the NICI from the UK, Royal College of General Practitioners from UK, and Zyme Health from the Scotland. All of them agree in terms of signs and symptoms during or following an infection with continue more than 12 weeks and cannot explain by the alternative diagnosis. It usually presents the cluster of symptoms, often overlap, which can fluctuation and change times on times and can affect any system of our body. It's very wide scope there. Lack of the unique agreement about the definition, we create the pseudonym of the post-COVID condition. There's sums of them. We know in terms of the post-COVID condition, long COVID, long haul COVID, chronic COVID syndrome, post-acute sequelae of the COVID-19, and long-term effects of COVID. Symptoms may be persist in the wide range of symptoms. Fatigue, cough, is from the respiratory tract symptom, even congestion and shortness of breathing. A lot of taste and smell that's realized, and headache, body ache, diarrhea, nausea, chest, and abdominal discomfort or pain and confusion. This is the report from the self-report symptom from the UK. Since last year, during March and June, there are many of signs, symptoms there. The same is true for even in the tabloid newspaper from the Sun from the England. As you can see, how many symptoms there, over 50 symptoms of the long COVID that suspect. who are susceptible to get the long COVID. There is a complex and challenge. We don't know exactly, but we gathered the information and we found it. And most of the people who suffered and we suspect about the long COVID associated with the pre-existing medical conditions such as diabetes, asthma, and hypertension, or people who get older and more than 50 years old, overweight individual, women, or patients who got 5 or more symptoms in the first week of COVID-19 infection. Wide range of the system and organ that affected. We can divide it from the physical side and mental side, from heart, lung, brain, and muscle, and mental health. From the heart organ, we know about the myositis, carditis, heart failure, from lung, damage from the lung tissue, capillary lung disease, from brain, brain fog or loss of sense of smell from the nervous system, and thromboembolic even from pulmonary embolism, the cognitive impairment such as the memory and concentration. For the mental health aspect, the anxiety, depression, PTSD, and sleep disorder, from musculoskeletal and other, from pain joints and muscle, and fatigue or chronic fatigue syndrome. And what does it mean for the patient who's suffering from COVID-19? It means that the disease can result in prolonged and persistent symptoms. And much is unknown. We don't know because the new disease just only nearly 3 years right now in our world. More time and research is needed to understand the disease. So, what the cause of the long COVID? Technically, immune system is condemned to cause the long COVID. As you can see, in terms of hypercoagulable state, endothelial dysfunction, or even the thromboinflammation and endothelial damage. There are many risk factors when patients from the COVID can get this immune system. ICU admission, cytokine storm, lung injury, inflammatory process, comorbidity, age, sex, obesity, even the cancer. As a NEOM, Nopparat Institute of Occupational and Environmental Medicine, Department of Medical Services, Ministry of Public Health, Thailand, is respond to a long-term COVID and return to work policy. This is an infographic of DMS. How to manage getting back to work after the COVID infection or long COVID. Before we move to another slide, when I got this topic, I will ask myself, why me? Why the occupational medicine physician? Why not? So the reasons are occupational medicine physician who specialize in health and work in terms of fitness for work, and have the professional experience in helping people to get back to work after illness or injury in terms of return to work. And next, but also help to prevent further sick by their work. That's the reason why me. We have to estimate a prevalence on the term of the long COVID prevalence, but it's not easy due to difference in method in surveys. For example, this is one kind of survey from the social media monitoring survey of the long-term effect from the WHO. We just look at here in the term of long COVID during the period of time, around 11% of people who discuss in social media discuss on this conversation. And that we know that on social media, around nearly 10% have the problem that they suspect a long-term COVID. Okay, but based on the other study from the other countries like UK, the USA, Switzerland, and the Netherlands and Belgium, as you can see, we are the wide range of the group of the patient and wide range of the percentage of the problem. For example, from the Office National Statistic 2020 population representative, around 20%, around 20% symptom more than 5 weeks, and 10% extend to 12 weeks or more. Whereas the 1,000 adults in 2020, but hospital OPD around the sample size is 127 to compare with nearly 8,000. In thousands report, 50%, okay, 52% report persistent more than 10 weeks. That so far we have the range of the long COVID is in terms of percentage of prevalent a lot from 10 to nearly 2, maybe on average, 30% of people who are suffering from the COVID-19 get the long COVID symptom. Okay, back in Thailand, in my country. According to the interview, the press conference, Dr. Piamlap Sangsayan, who's the head of the pneumologist department of Central Chest Institute of Thailand, what Dr. Piamlap point out, she said, there's no clear data collection in Thailand at that time on the September 14 this year. However, around 20 to 30% after the treatment will have symptoms of the fatigue. So far, the DMS, the Department of Medical Services, Thailand, is collecting information for further assessment signs, symptoms related to the long COVID. And my institute, Nopparat Ratchathani Institute of Occupational and Environmental Medicine, Onyang, Dr. Kriengkai Nam Thai Song, my director of Nopparat Ratchathani Hospital, revealed that according to the US data, long COVID symptom is found around 10 to 30% cases, regardless of age and severity of the disease. And majority will be in the working age group, that around the 40 years old, which impact in terms of economic burden. I suppose if we get around 300,000 workers there to get the impact, let's say 10%, that means 30,000 workers have the long COVID symptoms. That's a big rock there. with the nationality concerned. The Institute will establish the guideline for the return to work in the worker with the COVID. It will cover the long COVID symptoms too. And what we would like to point out, we would like to point out the consequence of the long COVID. We can classify or divide it in three categories: health category, work category, and social and economic. In terms of health, we know that the consequence is fluctuation that will vary in times and vary in terms of severity. The debilitating impact on health and ongoing rehab need. For example, like rehab for the lung function, rehab for the muscle gain. In terms of work, from work aspect, ability to return to work safely, ability to work demand, and management attitude to accommodation of return to work. And lastly, for the social and economic side, the financial problem, social attitudes, and social security system and compensation. Impact on ability to work. According to the studies data from the UK, around 84% limited their activity. Around 80% brain fog. Brain fog is the term just like the unclear of the brain and refer to the cognitive function impairment and maybe lack of the concentration. And 85% persistent of fatigue and nearly 50% difficulty of handling stress or doing basic tasks. Resulting in limited intensity and duration of work. From the interview, we got the long COVID will affect around 75% of the worker ability, 60% took time off, 45% suffer from return to work capacity. So it's very burden one. As July 2021, long COVID, also known as post-COVID condition, can be considered disability under the American with Disability Act. So for our team, occupational health and safety professional role, how to deal with this problem, how to deal with the workers. Those will function but limitation. Facility, safe, healthy return to work are based on ability rather than disability. Plan, support, and coordinate return to work. Multidiscipline approach, case by case, or tailor-made for the individualized risk based on approach. That means we can manage in terms of safety critical task, fit to work, and focus on ability, what the worker can do rather than what the worker cannot do. And phase approach on return to work, shop day, should be flexibility, accommodation, and hybrid working. Frequent reassessment, because as we know, everything changes day by day, and accommodation adjustment should be done. According to European guidance, they focus on stakeholder relationship. Worker and employer work together, including OSS team. We should reassure in terms of the word that although recovery slow, many people improve. Return to work is the part of recovery process. It must be flexible. That word reassure. And with all this in mind, it makes sense for the worker and the employer to work together to return to work. That's the most productive for all concerned. Focusing on return to work phase, start a new job and have any medical problem. Okay, please concern or refer to occupational health service. Some kind of job need special safety and health requirement. Therefore, they may need to health assessment. In those situations, please tell the occupational health services or physician to take care and it is legally advised. This means that according to the law, return to work meeting or interview, when we start return to work, so we have a plan before we get into the other information. Please hold a meeting first with the stakeholder. Uh, that consists of the occupational health service or physician or occupational health nurse, the HR, human resource, the supervisor, or worker representative. Secondly, talk about the processes and how to support the worker. Third, review as soon as possible the worker when they're back at work and review the workload to ensure the worker will not be under excessive pressure. The demand that we have to concern about the cognitive function, physical function, and emotional function. This could help to identify specific and useful to adjust the duty for the workers. But more or less, medical clearance before return to work is very important. Okay, for example, if the work involves heavy lifting and overexertion, so medical checkup on your heart function and lung function should be done. Other checkup, such as eye size and cognitive assessment, may be required if job positions are in safety critical role, or if worker get pre-existing health conditions such as diabetes and hypertension that have been aggravated by the COVID-19, and any previous work restriction must be revealed. In terms of adjustment of the work duty, can help anonymously. There are many options to choose, and it should be discussed among the stakeholder. It doesn't mean that only the doctor or nurse or even the manager to mandate or compulsory for the worker to get back to work. There are an example of the adjustment that I would like to show you. In phase return, we need a gradual onset to return back to work. After COVID-19 infection, people often need much longer times to return and back to work. On average, the 4 week at least. A standard short phase return is unlikely. It's unlikely to that. Phase of return can be adapted as time go on. It may week or month. There are no limit to the type of adjustment. It should be flexible. However, manager may not be able to accommodate everything. Please keep in mind, not everything the worker requests. This will depend on the job. Adjustment should be tailor-made as an individual. Depend on what your health problems are. They affect your ability to do things and your job roles. For the working hours, worker with fatigue syndrome, for example, I suppose remote working and pacing, especially working with the rest break as determined by symptoms are important. Some of them may be able to continue their full hour job, but the other have to reduce their working hours. That's more effective for them. In terms of the adjustment and in terms of an example of alteration. What alteration? Alteration in timing of job, in banquets, like what time to start, what time to finish, what are the rest break times. Or working out short rotation shift, day off shift between work day or shift work, especially consider suspend late or early shift or night shift. So individual can get when their best work pattern in terms of tempo or pacing, regular or additional break. In addition, in terms of the workload, we have to focus on, let's say, the new setting of fewer tasks, allow more time to work or finish their job, avoid working in a high tempo or tight deadline. Patient need to support by in terms of the body system or time off for the healthcare appointment. Moreover, working from home part of the times where possible. And patients with the long COVID regularly check on whether symptoms are fluctuate. If the symptoms get worse, they have to back earlier to see the doctor. In conclusion, although duration of the COVID-19 illness can be long, and that early return can cause relapse, but the principal return to work unchanged. And occupational health professional, such as the physician, nurse, have working knowledge of the workplace, and together with their medical knowledge, they are best placed to advise on workplace to prevent people to make sick by the work. Thank you. And any question from the floor? So I will return from my presentation to my MC, Dr. Kon or Dr. Punch. Thank you.